Join us in the Women's Networking Zone. We've got an excellent presentation and I've got no audience, so please do come and join us. I'm going to be talking about the Link Up project, which is a project working with young people all around the world to integrate sexual and reproductive health and HIV services. And it's a project that's really about the leadership and the voices and the visions of young people. So do come and take a seat. And we're going to get started. So, as I'm sure many of you know, there's a big and an ongoing issue with HIV and sexual and reproductive health services being offered separately in separate places, and this causes a real problem for people in terms of access, especially young people. And so, Link Up is a project that was put together to address that issue. Next slide. So Link Up works in 5 countries, Burundi, Bangladesh, Myanmar, Uganda and Ethiopia. I was losing one then. And the aim of the project is over 3 years to improve the sexual and reproductive health and rights of 1 million young people. So we're aiming high. The project is led by the International HIV/AIDS Alliance, which is based in the UK but works with country partners all around the world. And it's funded by BUSA, which is the Dutch Ministry of Foreign Affairs, and delivered by a consortium of partners. And this is the consortium of partners. Don't worry, I'm not going to read them all out, but right at the top there is my organisation, the ATHENA network. And for those of you that may not know, ATHENA is a global network of women working for gender equity and women's rights in the HIV response. So our role within Link Up is to make sure that gender and the needs of women and the voices of young women are heard within the project and within the integration agenda. And that gender element is really important in this project, because what we find often is that when people think about integration, they don't also think about the additional needs of women around things like family planning, around things like pap smears, around things like other women's health services. They tend to think very linearly of HIV and STI, and of course as women we have much more broad and diverse needs than just those things. So the issue that we're trying to address, young people aged between 15 and 24 account for 40% of new HIV infections globally. So increasingly the HIV epidemic is affecting young people, and it's about young people, but as I'm sure you know, young people are not being heard and being seen, they're not leading the response. And the services that young people need, sexual and reproductive health services, HIV services, are often delivered separately. And what we find, and we've found through this project, is that young people face barriers to accessing services. That might be discrimination and stigma, it might be financial or travel barriers, it might be judgment from the health staff, it might be difficulty with their families or within their communities. And the more separate services you have to access, the more those problems are compounded. So if it's difficult for you to access HIV testing, it's also difficult for you to access STI testing. It's also difficult for you to access reproductive health and family planning services. And the more of those barriers there are, the more likely it is that young people's needs won't be met. And Link Up also focuses on young people from the most affected populations. So that's young people living with HIV, especially young women, which is ATHENA's focus. Young sex workers, young trans people, young MSM, and young people who use drugs. And we focus on those key affected populations because in addition to being young and experiencing barriers to services, these people also experience other forms of stigma and discrimination and marginalisation that add more and more and more barriers to accessing services. Can I have the next slide? Thank you. So what are we trying to do? Well, through Link Up, we're trying to link up sexual and reproductive health and rights and HIV information, first of all, in all information, education and communication materials and trainings, especially for peer education. We're also working to link up services. So Link Up, the global project, works in two parts. The service delivery is led by linking organisations in each of the 5 countries, along with many other community-based organisations as partners who are actually delivering integrated services. So they're putting the arguments we're making into practice. And also linking up services that exist provided by community-based organisations and by clinical services. So we find that particularly for marginalised populations, there may be services provided by community groups, but it's difficult once you've, for example, accessed HIV testing in a community-based organisation to then be linked into treatment and care. And then the final element of Link Up, and the element that I work on, is linking policy and advocacy and decision making around HIV and sexual and reproductive health and rights. So as an organisation, ATHENA does both. Our specialism is in both HIV and SRHR. But what we find in global level advocacy and policy development is often those two issues are treated as though they're separate, as though they're two separate things, separate issues. There's separate groups of experts, there's separate government officials who are interested, so it's really difficult to join those pieces together. And that's what the policy element of Link Up is aiming to do. Next slide, thank you. And the policy is led by global policy partners, including ATHENA and GAICA, the Global Youth Coalition Against HIV and AIDS, who conducted the consultation that I'm going to be presenting the results of. And then the really important element of policy and advocacy within Link Up is that we work with young people and are led by young people in each of those 5 countries we work in, ensuring that they are the people engaging in the national and the global policy processes. And we also work with focal points in those countries so that all of the consultations, the community dialogues, the focus groups that are held to inform the policy work that we do are led by young people. So it's not a case of bringing young people in to confirm what we're already doing. They're at the centre, they're deciding what questions to ask, who to ask them to, when to ask them, and they're doing the asking. So right at the outset of the Link Up project, GAICA and ATHENA work together with young people in the 5 countries to conduct a really large-scale consultation of young people from populations most affected by HIV to find out what their needs are around SRHR and around HIV and around integration. There was 2 elements to the consultation. The first was a global online survey. Almost 800 young people responded to that, and it was available in 5 different languages. We also, young people in the 5 Link Up countries, carried out focus groups and community dialogues and discussions, and more than 360 young people participated in those. And again, those were held in local languages and in the languages most accessible to young people. And they were also held around the country, so in urban and in rural areas, and we took them to young people to make sure they were accessible. So there's some information on the slide about participants. I won't go through it in too much detail, but what that shows is that we got participation from all of the groups whose needs we're interested in, and young people from across the different populations were heard. And the point at the bottom is an interesting one. Of the people that attended the focus groups, around a third didn't identify as a specific group, and we think that was because they were uncomfortable to do so in a public setting within a discussion. So the consultation was held in the 5 countries, in Burundi, Bangladesh, Ethiopia, Myanmar and Uganda. And the results of the consultation were evaluated country by country. And what I think you all now have copies of are these fetching papers. Each of these is the results from each country. So the results were published separately so that we make sure we're recognising the different experiences and needs of people in each different setting. But what you'll notice on those papers is that the outcomes of the consultation showed a really similarities between the countries. So broadly speaking, the feedback we got through the consultation fit in under these headings in each case. So that was human rights, including sexual and reproductive rights, comprehensive sexuality education, access to services, meaningful youth participation, and addressing gender-based violence. And those themes emerged across all 5 countries, although the detail varied slightly between. And please do take away copies of those papers if you're interested. So what I'd like to do now is go through country by country and just give a sample of the key issues that emerged out of the consultation. So starting off with Bangladesh, young people that took part in the consultation felt there was a real lack of comprehensive sexuality education. There's cultural taboos around discussing SRH issues, and gender inequality came through really strongly in terms of SRH and family planning decision making. So young women participating in the focus groups and in the survey told as well, family planning is not my decision, it's for my husband, it's for my parents, it's not my choice to make. And that was reflected, that gender inequality was also reflected in condom negotiation, both for women and for men who have sex with men, and also particularly in people who do sex work. And this is a quote from a young man who has sex with men and does sex work in Bangladesh, who says that he is most of the time not able to decide whether, when, where, how to have sex. That decision is made for him. Moving on to Burundi, the Burundi paper you have is in French, so if you have any more questions about that, I can't answer them because I don't speak French, unfortunately, but this is a sampling of what's in that paper. And just to note, that was in French because obviously the partners and the young people in Burundi are French speaking, and that was given back to them there to inform the rest of their work. The other, the Bangladesh and the Myanmar papers were translated into local languages, but we didn't bring them to this conference. So in Burundi, the key issues that came through were, first of all, a real lack of youth-friendly centres. And this was an interesting one because there had been youth-friendly centres before, but they had been closed down. The government had taken the funding away. So those centres had been there, and the Burundi young people really had a different experience in a lot of cases to young people in the other countries who had never been able to access those services. In Burundi, they had them and they lost them. But in a really exciting for us development in Burundi, one of the young people's groups that we work with, the Network of Young Positive People in Burundi, has now opened a youth-friendly SRH and HIV centre, and they had the launch just recently, and that is something they've sought funding for themselves. It's managed by young people, mostly young people living with HIV, and all of the services are peer-led and peer-informed, so that's a really exciting step forward. Can you all still hear me? Am I loud enough? Cool. So other issues for young people in Burundi were harassment and discrimination, especially for young people living with HIV and for young trans people. There was, again, an inability to negotiate condom use, particularly for young people doing sex work and for young women. And again, for young people doing sex work, there was a lack of condom use with primary partners. So that was young people who, perhaps when they were doing sex work, would seek to use condoms, but with their own partners in their own lives, they wouldn't. And again, a real cultural and social lack of acceptance of the sexuality of young people. So young people with questions or seeking advice or seeking services or testing around sexual behaviour and sexual rights were being told, well, you're too young, why are you asking these questions, what do you need these services for? There was also a real lack of access to safe abortion. And some more quotes here from young people living with HIV, which really speak to what we heard a lot from young people in Burundi, which is that, if I read them, people already believe that it is forbidden for us to have sexual relationships. So imagine yourself the discrimination that you can suffer if you're pregnant, because that indicates that you have had sex without a condom. And again, in the second case, there was this experience of young people living with HIV that if they were seeking SRH services, they were hearing, well, you have HIV, you shouldn't be having sex. And that's one of the reasons why Link Up is really working to integrate those services, because we see across the board people living with HIV really struggling to access condoms, to access STI testing, to access family planning because of this discrimination against the sexuality of people living with HIV. Moving to Ethiopia, abortion was an issue that came through really strongly. So there are some safe abortion services, we heard from young people, but they're inaccessible, they're very expensive. And this leads to an issue that came through quite uniquely in Ethiopia of what were referred to as abortion brokers. And this was people who would connect you with an abortion provider, but not a proper health facility, not safe. But they would do so for profit. And that was often the only way young women had of accessing abortion, because the official, if you like, facilities were so expensive and so hard to access. And that was coupled with a real lack of knowledge around availability and the legality of abortion. So abortion is legal in some cases, but many of the young people that responded to the consultation and to the survey said that abortion was illegal. Actually, they thought that it wasn't possible to access legally and safely. And again, this issue of sexuality not being recognised as a right, not being recognised as appropriate for young people. And the bottom quote here speaks to the challenges women face around family planning. And this came through very strongly from the Ethiopian survey results that in this woman's case, her husband didn't want her to use family planning because he wanted to have more and more and more children. So she was using family planning. She was taking the contraceptive pill, but doing so secretly. So keeping the pills hidden, taking them when he wasn't around, and that would sometimes lead to her not being prepared, not having taken the pill in time. In Myanmar, young women living with HIV again told us that they didn't know how to access services for safer conception. They weren't sure if they could have children. They were afraid of the judgment and discrimination they would experience if they did. Decisions around where, when and how to have sex, if to have sex, the use of condoms and contraception, mainly made by the male partners. And that's both male partners of women, whether women living with HIV or other women, and of MSM, and of men who do sex work with male clients. There's also in Myanmar a real issue around services in rural areas. So within the cities there's some HIV services. Once you're outside the city there is none, and it's enormously difficult and expensive and challenging for people to travel. And again, issues around blame, stigma and discrimination, creating barriers to accessing services and support. And one of the things that came through really, really strongly in Myanmar was how peer support was really vital, was really sought and really appreciated. The photo you can see here is a young women's dialogue with young women living with HIV that was held in Myanmar as part of the consultation. All of the facilitators were women, young women living with HIV, as were the participants. And one of the women taking part said, "We need to be healthy so that we can help our sisters who are HIV positive, and we do not need to be depressed at all." For many of the women taking part, it was one of their first experiences of being within that peer group and of being amongst other young women living with HIV and being able to be open and to share experiences without fear of judgment or discrimination. Moving to Uganda, one of the things that came out of the consultation was a real lack of trust in services, including HIV testing. So some of the young people responding were saying, well, I've done an HIV test, but I don't know if I can trust the result. I don't know if it's accurate. Lots of myths and misinformation around SRH and HIV. So people believing things around family planning that were not true, methods of preventing pregnancy that wouldn't work. There was also really high levels of violence reported amongst sex workers, members of sexual minorities and women living with HIV. And again, a real lack of both youth-friendly services and tailored services. And again, access to safe abortion, both limited and expensive. And this is an example in the quote of a young woman who had always wanted to take an HIV test. She felt she needed to take one, but was afraid to go to a hospital service. She was afraid of the queues, of the treatment she would receive at the hands of nurses, the possibility, as many people reported in the consultation that they'd experienced, that you would wait for a long time and you'd still not be seen, you'd still not get your service. She then managed to get a test from a counsellor who was going door to door, but was not confident that that was somebody who had done the test accurately and had given her the right result. So even having done that test, she didn't know if the result was accurate. And there was also the problem, although she didn't discuss it, that she'd done this test but she hadn't been linked into any services, she hadn't been linked to support, she hadn't been linked to care. So building on this consultation, as I've said already, we've published the results in these country-specific 2 pages. There's also a longer report that considers the consultation as a whole. And that the feedback on that consultation and the many hundreds of young people that took part has been used at both the national and the global policy levels. So in each of the 5 link-up countries, the local lead organisation is being capacity built to take on advocacy work, and they're using the consultation to design an advocacy plan. So all of the objectives they're advocating for, all of the lobbying they're doing of government, of health services, of leaders, is framed by and informed by the voices of the young people that took part. Similarly, at the global level, the global policy partners, including ATHENA, are using these consultations to feed into our work, which so far involves influencing at things like the Commission on the Status of Women, ICPD, and the post-2015 development process. And in all of that advocating and lobbying and policy work, young people are leading the way. So in each of the countries, both ATHENA and GAICA, the Global Youth Coalition, works with a young person from a key population as our focal point in the country. So from ATHENA's perspective, we work with 5 young women living with HIV, 1 in each country, and that young woman leads our policy work. So she is responsible for working with her peer group, for leading community dialogues, for leading consultations, for feeding that back to us so that we can make sure that feeds into the policy work. Those focal points also work on national advocacy. They attend all of the advocacy planning meetings. They attend all the lobbying meetings that take place so that their voices are really being heard and leading the way. We also, through the Link Up project, support young people to participate in global policy. So in each of the global level meetings that I've mentioned, including actually this conference, and where there's a Link Up presence, young people from key populations are here, they're being heard, they're on the panels. Unfortunately, I'm here on my own today because we have 2 Link Up panels at the same time, and a bit of poor planning on my part, largely. So I'm out on a limb by myself, but all of our other Link Up activities at the conference have got young people leading the way. And similarly at the Commission on Status of Women, we supported 2 young women from Uganda to attend. They sat on panels, they addressed high-level meetings, so that it's young people themselves that are talking about what young people need and young people want. So the next couple of slides I'm going to go through are some feedback from our focal point, ATHENA's focal point in Uganda, a young woman living with HIV called Jacqueline, who unfortunately couldn't be here for this conference. She'd got another engagement, but she has, through Link Up, led a series of community dialogues. She led the survey in her country. She attended and spoke at the high-level panel on women, civil society and youth at the UN in New York, and also at the Commission on the Status of Women and other regional and global conferences. And because she couldn't be here, I asked her to give me some feedback to share with you, which is what's on the slide. So first of all, what does being a focal point involve? She said it involves lots of commitment, determination, understanding and loving what you're doing in the field you're assigned to. So far, her best experience has been learning from the Link Up partners in those different settings. In terms of highlights, so she's been really involved in leading the development of the advocacy strategy and advocacy work in Uganda, working with the local partners and with the global partners, as listed there. And through being a focal point, she says she's learned a lot, and the major thing was being able to trust and work with a global network. So she is, as well as being an ATHENA focal point, she works with a number of organisations and networks in Uganda, and she's able to play that brokering role of linking in between those different groups. And what she hopes to achieve next. She's in the process of applying for a global advocacy role, and I won't say what in case I mess with her chances, but she's hoping to be accepted and feels that would be an achievement and a development of her advocacy and focal point role with Link Up. And again, to keep working with and meeting with young women living with HIV in Uganda to educate them and to bring them into policy work. So what we've learned from working with focal points, and I really want to focus on this because we think the focal point model is a really interesting one for global level organisations to do, because for an organisation like ATHENA, which works internationally with partners and with networks, we can nevertheless, as an international organisation, be a bit disconnected from the experiences of people in their communities, in their real lives, on the grassroots. And the focal point model is a really exciting way of making sure that young people are supported and their capacity built and their work brought into these projects, and that leadership and that input is really valuable. There is also some challenges. So one of the things that we as ATHENA have made sure is that all of our focal points are paid, and they're paid for their time, they're paid for the work that they do to enable them to participate, because very often, particularly for young people, they're expected to volunteer. And we and the young people we work with think that that's actually a really good way of excluding a lot of young people, because nobody else is working for free. As a young person, you need to earn a living as well, and your work should be recognised. An additional challenge, which I'm sure you're all familiar with, certainly people at this conference are familiar with, is around visas. So we worked really hard to try and get one of our young women focal points to this conference. Visas, they're not here. Yeah, there seems to be a real challenge for particular countries. Well, I really agree. I think if you're going to have an international AIDS conference, you should have it in a country where everybody that should be here can be here. There are far too many people missing from this conference, and they're missing because of visas, they're missing because of costs, and it's not right. And also, a linked issue for us is around language. So although as ATHENA we're an English-speaking organisation, it was really important to us that that wasn't a requirement for our focal points. So of the 5 focal points we work with, 3 of them don't speak English. 2 of them don't speak English at all, 1 speaks a very little. So there's a sort of practical challenge in that, where alongside our focal points we work with either local consultants or local organisations who we pay an institutional partner fee to provide the kind of middle step between us and the focal point, so they can translate for us on Skype calls, which I'm sure you can imagine doesn't always work that well, because getting 3 people on a Skype call is hard enough when you're not all speaking in the same language. It's tricky, but again, in terms of young people's leadership and participation, for countries like Myanmar and Bangladesh, very few young people can speak English, and those that can are often, that's to do with education levels, it's to do with class. And it's not right for only young people that can speak English to be able to engage in policy and to be able to be heard. So within our own work, we can manage that, but for something like this, for this conference, we looked at, for example, bringing our young focal people from Bangladesh and Myanmar to the conference, but we would have needed to also bring a full-time translator in order for them to participate and engage and gain anything from being here. And you can't get a translator to work 18 hours a day, so we were going to need a team of translators, and the costs were off the scale. It just wasn't possible to do. So there is a real question, I think a challenge to the global policy and advocacy community, of how do we make things linguistically accessible? How do we make sure that we're not only hearing from the people that can speak to us in the language that the conference is held in? Because actually there's no real reason why the conference should always be completely in English. And translation for this conference has, again, I think, been something of a challenge across the board. And in terms of learning, one of the things we're now looking at, so Link Up is a 3-year project. It's going to end of next year, beginning of the following year. And what we don't want to do is get to the end of the project and pull the plug and walk away. So what we're already thinking about is how can we make sure there's sustainability, both for the young focal points that we work with, so that it's part of a process of development and moving forward for them, but also for the networks that they've formed. In many cases, they've now got peer support groups, they're working with local, national and regional organisations. How can we make sure that that continues beyond the life of the project? It's a big problem, particularly with multi-country projects, that funding is 1 year or it's 2 years or it's 3 years, and what we don't want is to create a cliff edge at the end, particularly also on the service delivery side of the project, that it's amazing to do a project where you create integrated services. If then the money goes, the services go. So that's a big question for us, and one of the things that we're, in terms of the focal points that we're doing to address that, is creating an opportunity, and a funded opportunity within this year, for young people to develop their own projects. So, for example, in Burundi, Nadia, our focal point there, has developed a proposal and a project structure and an idea for female condom and other family planning services, engagement with young women living with HIV. So she's in the process currently of carrying out focus groups. We're helping her to develop a funding proposal, and we will support her to seek external funding so that she can lead that project beyond and outside the lifetime of Link Up itself, because it's about sort of building on the foundations that are there. And that's it. So thank you so much for your attention, especially when there's a million other noises competing for it. Please do take as many copies as you'd like of the papers, and if anyone has any questions, please feel free. And if you have questions, do come up and grab the mic, because you'll ruin your throats if you try to shout loud enough to be heard.
Hi, my name is Sushil. I work at APN Plus. Also do a large-scale study on PLHIV, especially in Asia-Pacific region. You hear me? All right. I can be louder than this. There are a couple of observations that I wanted to share. First and foremost, I think it's an excellent work that you're doing, and we all love work on youth and adolescents, which I believe is the most ignored and the most important population in today's drive for targeted interventions and all the focus interventions, because they seem to be cross-fertilization between these few groups, and nobody cares about focusing on youth so much. But it's also been true that there are a lot of programs running in the countries where there are experiences that we can use. 2006, there was a pilot intervention that we did among youth-friendly services in Nepal, where I used to work, where we learned a lot of things beyond, just youth participation, and it is not an easy task. That's all I can say. I think the clear issue here sometimes is, like, we talk about youth or young people or adolescents being part of programs, and then we talk a lot of that in the global level, and we go to the countries, do studies, and then we talk about that in a global level as well, and there is no, the pipeline is very long. Something coming down from a donor perspective or an influence, sometimes it takes far too long and it's not very effective. So I was wondering if you're doing more work at the country level to engage with the key players at within the country, because over the years what I've learned is they're not as bad as we think they are, and sometimes it's also important for us to be able to convince them where policies are influenced much more easily than that. That's probably the first thing. The second thing is the research, studies and observations, that's what I do as well. So I think it's very important. But then the actions and the follow-up and the response sometimes are, expected to be filled by some other people. It's more of, oh, we did that, we found that out, somebody else have to chip in. And sometimes I don't think it's fair to the communities that we go ask questions and never come with a response. So I wanted to hear your point of view on that. Thanks.
Thank you. Two really, really interesting questions. Thank you. So first of all, in terms of what we're doing at the country level, in each of the 5 countries, Link Up is delivered and led in country by a local organisation. So they lead the project in that country, and they then work with and fund a whole range of other implementing partners who deliver services to different groups and in different settings. And building on the consultation and the advocacy development, what we've done is in each of those lead organisations, Link Up funds an advocacy officer who has been trained and supported. Because one of the things that we found when we were preparing the project is that often our country partners said they really struggled to access funding for advocacy. They were expected to do whatever advocacy they had to do for free. And it was really challenging then for them to devote time and resource into capacity build. So there's often a high turnover of advocacy people because they're volunteering. So we fund advocacy officers to lead the advocacy in country, in the partners, and they have just recently in each of the country completed or nearly completed the advocacy development process. So that was a 5-step process that started with a youth dialogue, with young people sharing their issues, building on the consultation. There was then a stakeholder consultation. And the stakeholder consultation was facilitated by young people from key populations, but the stakeholders engaged were government officials, politicians, service providers, healthcare professionals. So they were brought together to share their views of SRH and HIV integration and the needs of young people, but led by young people themselves. And we found that actually worked really positively to engage people, particularly politicians and service providers, around what the issues are in a way that was much more meaningful than kind of handing over a report can sometimes be. Building on the stakeholder consultation, there was then an advocacy strategy development workshop where young people, implementing partners, lead organisations and stakeholders came together, and the young people led a process of figuring out, well, what are the changes we want to see, what are our objectives under those changes, and how are we going to get there. And those advocacy strategies have now gone back for the next stage, which is a kind of a check-in with the young people that took part in the consultation. So it's going back to them and they're saying, does this match with what they were saying? Does it meet their needs? Is it addressing what they think are the priorities? And that kind of confirms that it's on the right track. And that advocacy process will then be led in country by the lead organisations, but with the buy-in, thanks to the stakeholder consultation, of the decision makers at the top. What was your second question? Yeah. So that question of follow-up is a really important one, I think. And one of the great things about the young focal points leading the consultations is that they already work with their peer groups, they have the links, so they've gone back to them. All of the findings have been made available and translated, and in other formats, so it's not just a sort of 2-page report. There's also blogs and social media and video and different ways of accessing the information. Young people that took part in the consultation that wanted to be further engaged were enabled and funded to take part in the youth dialogue and the strategy development process. So that was an opportunity that was made available to everyone that wanted to take it up. And that process is a way of making sure that people don't just share their views and then fall off a cliff. They're engaged ongoing through the project. I think my time is up, so I'm going to close there, but I'll hang around over there if anyone has further questions that you want to put directly to me. Thank you all so much for your time and your attention.